Hello everyone, good evening and welcome back to my mental health and crime channel. My name is Huda London. Please like, share and subscribe. I'm a licensed cognitive behavior therapist and a mental health counselor. Today I would like to talk about Beatrice Bijoux. She is a 31-year-old woman from Florida who ran over four people with her SUV and she fled the scene. Four of the people were injured. One was, I think, quite injured that he had to be flown or she had to be flown with a helicopter. And the other three weren't that badly injured, but a lot of damages happened there. She is even being charged for using the car, obviously a deadly weapon. She's going to be charged and sentenced for attempted murder for the four people, and we still aren't sure if that was under mental conditions like she claimed to have. Immediately when the police, law enforcement pulled her up, she said that she had bipolar. She was diagnosed for bipolar and schizophrenia, and that was in 2019. She even gave her psychiatrist's name that is dealing with her mental illness. She even explained which medications she uses. She was asked when she took her medication. She said she took it the same morning that she did it, but she was honest enough to say that I do not take my medications regularly, and that is a concern because when people are on serious mental illness medications like schizophrenia, it is important that they take their medications and take the recommendations given by the psychiatrist or the therapist or the doctor. The reason being, if you start these medicines and stop taking it, if you are if you're bipolar, it will affect your moods and it can trigger up your manic bipolar side. It could do a lot of damage. So the medication is really important. So I can imagine from 2019 up to February, 2nd February, when Beatrice did this accident, it didn't seem like she was under any psychiatrist or any medical care like psychiatrist or therapy or something like that. Because if she was under counseling or therapy, we would have notified our supervisors and the supervisor would have informed the person, his GP, the doctor or the psychiatrist, that something's going on, or that like there's trigger warnings, especially when that is one of the rules in counseling, and I'm sure it's the same in every country. Counseling is counseling. One of the rules is that if we have a patient who shows symptoms of suicidal, we are immediately supposed to notify a supervisor and then the psychiatrist so that they take steps to see what they can do different, if the medication needs to be changed, because in some cases not all drugs, all kind of medications do not work exactly the same for every patient. Obviously clients are different and they suffer from other health issues. So it's important that like the medications that they're using regularly, example for the schizophrenia or bipolar, it may help them to control the voices, the delusions, the hallucinations and many things. It can keep that in check, but then it can end up giving them high blood pressure or diabetes or high cholesterol or something like that. So it's very important that when somebody is under bipolar, schizophrenia, and many other serious mental health illness, the medications that are recommended from the psychiatrist is important that they take. So if Beatrice wasn't under any medication since 2019, that raises alarms automatically. She said that she had schizophrenia and she heard voices telling her to run over the people. I would kind of believe that because this woman wasn't mentally fit. You could see that she was even saying that when she was in the with the police and when they were taking down her statements, she was saying that she doesn't want to plead for to drop the charges and all. She wants to take that she's guilty. She said that she intended to kill the people and intended to kill herself. And I believe she's been very honest there because the voices in her head when she's having the delusion and like the hallucination, she is going to kind of go by those voices. So it's not something sorry, if she is diagnosed for for those two disorders, they are severe disorders, especially schizophrenia, and and then she will be going through symptoms of hallucinations, delusions, and yeah, obviously hearing voices, cognitive behavior issues. It can lead to suicidal thoughts, people who have schizophrenia in most cases. And then she has the bipolar side that can lead to suicidal thoughts that are quite high there. It depends what kind of bipolar she has, if it's bipolar 1 or 2. So, and especially that she's not taking her medications and that she's not under therapy plays a lot of role. That plays a severe role in it. But I personally did not like the way the law enforcement in Beatrice's case treated her. I do understand that they do not have much experience in the mental health branch, but I believe that they should have immediately called a psychiatrist for Beatrice because you could clearly see that the state of mind she was in was very unsafe for her and for the officers around her, especially. You could see the way she was sitting. She was full of anxiety. She was like just literally holding, like hugging herself, kind of. You could see she was asking for an attorney, and then she was saying, "No, I do not want an attorney." She kept on doing that a couple of times, at least more than 3 times. So if I was the officers, I would have got a psychiatrist and I would have got an attorney immediately. Whether she wants it or not, I would have got an attorney, maybe silently to listen to the background, and yeah, and explain to her later when she's in a right state of mind. Because right now I believe that she was having a psychosis, she was having a psychotic episode. So the first person they should have immediately sought help from was a psychiatrist, and then a psychiatrist will definitely put on the right medications, maybe put her in an institution for a while in a clinic institution just to make sure that that she comes back, I wouldn't say to herself, but then she comes back to more to reality. Basically in schizophrenia what they try to do, I believe, is try to put the patients on medication so that they stop hearing the voices, so that the voices decrease, which is important because mostly the voices are not always positive. They tell them to harm themselves and harm other people. So I would have preferred if they called a psychiatrist or someone in the mental health department to even guide her, to sit and talk to her, because it's important. Even how you talk to a person with mental health illness is really important. You have to be mindful, and to even for I do understand the police are there not as psychiatrists and as counselors. They are there to do their job, to keep law and order. an order basically. But in this case, it was about safety case too, because you could see that the woman, without being a psychiatrist or without being a counselor, it's easy to see that the woman wasn't in a right state of mind. You could see that she was very confused. And I think like she was basically, maybe for all you know, maybe she didn't sleep in days and days. Maybe she's suffering of insomnia since she has bipolar too. But I hope we get to the bottom of this soon. I hope they have already started putting on her medications so that she can deal with the, like, have a maintenance, that they maintain all her medication, her therapy, and maybe they will get closer to the truth. And if she's guilty, then may justice be served. But if she's a mental health patient, I think they need to take it easy, because especially if she is a mental health patient, then you have somebody who has bipolar diagnosis and schizophrenia, allegedly, if that is what she has. And if she gave even a psychiatrist's name, so if she's suffering under those mental health illnesses, especially schizophrenia, I believe there's only 2% or 1 comma something percent of people in America who have schizophrenia. It's not a very common, it's not a very often mental health illness, but then it seems to be getting more and more in our society these last couple of years. And till today, researchers are not completely sure where schizophrenia comes from, because they don't believe it is genetic, but it could be a bit of it. So they're really not sure if it's a neurologist thing, if it is something that you're born with lesser, like, not lesser cells, but there was something with the cells in the brains to do too. But schizophrenia patients really do suffer, because you can imagine when they're having active schizophrenia, that is what I believe she was actually having, and the bipolar was kicking in too. She must be having the depression or the manic side on the other way. So this is a comorbidity that we see two diagnoses together, and then you can imagine she definitely has anxiety, depression, and many other mental illnesses going on. So I really hope that they do the right thing. But I'm sure now that she's in the trial, and since the judge, that is the part I still can't understand. Since the judge wants to proceed by giving Beatrice Bijoux, like by charging her for attempted murders, then I'm sure they must have done a psychiatrist evaluation, because the way I know and the way we all know, you do get a fair psychiatrist evaluation in court. I've been trying to check today, but there isn't much more about this case written, but I'll try and check what I can. And I just hope that justice is served, like for these innocent victims who are busy doing shopping, who did not deserve any of this. I would advise everyone to stay alert, stay mindful, always look around your surroundings. Weird things and strange things are happening these days that we can't even explain why. And I believe that many people, that is another thing I thought, I believe that she is a victim of mental health, but it could be possible another thing, that she could have mental health illnesses, and then she must have started doing drugs, God forbid. But I'm sure the police have taken blood tests and all of that, because that is another thing. People with schizophrenia and bipolar, we try to keep them away from drugs and alcohol, and most of them are under addiction. I wouldn't say all of them, but many of them. So we don't know yet if she didn't look like she was drinking or anything of that sort. I just believe just having schizophrenia isn't a pleasant, joyful ride. So she had enough. It's like wrestling with yourself in your mind. So may God make it easier for her too. Everyone, please take good self-care, look after yourselves, and have a lovely weekend. Love you all. Bye.